Welcome back. In this video I've put the highly characteristic features of the most common thyroid cancers. So let's start. First off, we have thyroid adenomas. They're usually benign and solitary. Most of the time they're also cold nodules, which means that they're non-functioning, but they can become hot or toxic, which will cause hyperthyroidism. Almost never metastasize or invade. And under the light microscope it's going to resemble the normal thyroid tissue. Here, as you can see, the thyroid adenoma is just one large nodule. And under the light microscope it looks exactly like a normal thyroid tissue. Next we have the papillary carcinoma, which is the most common thyroid cancer and has excellent prognosis. And under the light microscope we're going to see something called orphan Annie nucleus, and we're also going to see something called nuclear grooves and samoma bodies. We'll see how each of these look like. And the risk factor for papillary carcinoma is childhood radiations or mutations in the gene RET or BRAF. Here you can see the orphan Annie nuclei and the orphan Annie herself, which they get the name from. Here you can see the nuclear grooves. And here are the samoma bodies. Next we have the follicular carcinoma, which is highly characterized by invasion. It would usually invade the capsule and the blood vessels within the thyroid, so it will hematogeneously spread. And the risk factors are RAS mutation. Here you can see the follicular carcinoma invading the capsule, and here it's invading the blood vessel. Next we have medullary carcinoma, and the origin for medullary carcinoma is the parafollicular C cells in the thyroid. Medullary carcinoma can secrete calcitonin, and they usually have amyloid stroma, which we can stain using Congo red. The risk factors are MEN2 mutation and RET mutation. Here you can see amyloid stromas stained using Congo red. And finally we have anaplastic carcinoma. It's sometimes also called the undifferentiated tumor, and it's usually appearing in older patients, and it would invade local structures in the neck, and it also has the worst prognosis. Here you can see why it's sometimes called undifferentiated tumor. On the sides you can see the normal thyroid tissue, and in the middle is the tumor. Alright guys, so that's everything I've got today. I tried to put the highly characterizing features for each tumor in each slide, so if you memorize them you'd be able to recognize which tumor it was, and the pictures also, so sometimes they put histology pictures. So if that happens you can also solve the questions. Hopefully this video is going to help you. Hopefully you ace the exam, and see you guys later.